The governor is making it a requirement for state employees in indoor settings and urging all other employers to do the same. Oregon has seen a steep increase in COVID-19 rates and hospitalizations driven by the Delta variant. Schools are mostly unvaccinated settings. Universal and correct face coverings can keep students in learning in person by reducing infections and quarantines, especially when paired with other layered mitigation efforts. Statewide mask requirement be unexpected. We have shared since spring, basically since this is from the state, Dr. Fauci, we don't make the timeline, the virus makes the timeline. As we have new tools like testing and vaccine, we must respond. The impact of COVID and the conditions change, and we must respond. We learn more about the disease and its behavior and its impact. When that happens, we must respond. It's more transmissible right now for children, the COVID-19 Delta variant. The virus' ability to spread quickly is especially worrisome. Only half of the children who are eligible to be vaccinated, said Jennifer Leiter, pediatric infectious disease specialist at New York University. That's pitiful. COVID-19 and flu in children have the same kind of morbidity, she said. Doctors say that there isn't a good sense yet of whether the Delta variant is more severe for children than the previous versions of the coronavirus. Because of lack of data that we know from adults, including younger adults, we have seen an increase in hospitalizations. If the Delta variant spreads through our schools, it will impact our staff, our students, our family members, some of whom may be at greater risk. In my role as a superintendent, I am required to carry out and enforce all policies of the Grande School District, which include following federal and state laws. Our school board also took an oath to carry out the duties with state laws, policies, and administrative rules. Our students, staff, and schools should not be in the middle of this polarizing issue. None of us asked for mask mandates. However, I do want to make it clear, even if we personally disagree with state orders from the governor, our school district does not have an option to violate state orders. As a community, regardless of where we stand on vaccines and masks, we should work to be as helpful as possible to our schools. Students need us to be together. They need us to be collaborative and supportive of one another as much as possible. Their learning and their ability to thrive is based on the support of us working together. This will be the third school year where our teachers and many of our students will have to experience the impact of COVID. And the restrictions that have been created should not diminish the quality of education services and activities that we have worked hard to develop for them. The Grande School District has long advocated for local control, context data, and collaboration with our public health and emergency officials to make our own decisions. We must be given the opportunity to make at the local level to implement our safety key practices and utilize our operation plans. My stance has been that we can make decisions based on our local context, and state mandates should be our last resort. The Grande School District and our Board of Directors will continue to advocate, lobby, and stand up for the Grande School District values and to retain local control and decision-making in what is the best interest of our community and our school district. Should you wish to write to Oregon Department of Education, Oregon Health Authority, our governor's office, your local state senator, your state representative, to voice your perspective, you are encouraged to do so. I do ask for your support in making it a great school year for our students. We must focus on relationships, on learning, and on ensuring that our students and staff thrive. We must stay in operations in person, and we do wish to stay in daily routines and operations with minimal disruptions to your child's learning. Again, in the last section, I'm sorry if I'm repeating myself. What does it mean if we violate state orders? Each occasion of a verified mask violation is subject to a $500 fine, $500 for each instance of a violation per student, per staff, per occasion on the same day. Administrators, teachers, and licensed staff that refuse to follow state laws may result in sanctions from the Teacher Standards and Practice Commission, our state licensing board, for ethical educator violations, for leadership standard violations, and not following state laws. Board members swear to obey the Constitution of the United States, Oregon laws and statutes, as well as follow board policies. School insurance, risk and liability will not be covered, and the board members' personal liability protection will be following state laws. Is this rule in full effect for the 2022 school year? No. The goal is to go back to board decision-making. OHA, Oregon Health Authority, will review the situation of these.
I'm a PE teacher, and I am opposing. We need to have the mask on. We need them for them to play, to run. We can't see their faces. Thank you.
Not the authority of the Lord Jesus Christ. To come against this evil fruit, not against the people. It has nothing to do with people. It is an evil fruit, it is a spirit. The devil has loosed his magic upon this earth, the Lord has allowed it. We need to come together, we need to love each other, and we need to take care of each other. And together, we can come through this pandemic. I'm also here to stand in front of all of you and alongside of you, to support you, to work together with you, that I have the same values and views as the rest of you. The mask has got to go. There's a way to hide people's facial expressions. They show love, they show compassion, joy, even discontent and anger. It hides it all. It's a trick from the devil. And we've been deceived if we're going to let people that we supposedly elected into office tell us how to operate and function. It's not right. It's unconstitutional. And also, to the teachers, I'm here to stand along you as well. You're here to teach our children to be critical thinkers, to think for themselves, not to tell them what to think. So what's going on in this evil fruit is 100% wrong, and the Lord Jesus Christ will prevail and will win, and the evil will be extinguished, the lake, and the fire pit of hell for 1,000 years.
Honestly, I'm a homeschool mom from the Grands, and the reason I'm here today is because I was out watering my lawn, and my neighbor confided in me that her daughter had tried to self-harm several times, that she's on psychiatric medication to help with that. And then as she continued to talk, she said, and then this friend has tried to commit suicide twice, and her other friend has tried to commit suicide 3 times, is in an inpatient facility right now. This is crazy what is going on with our youth. They're not surviving this well. I was talking to another friend whose husband is a paramedic, and he says, why aren't we talking about the epidemic of all the calls I'm responding to for overdoses, for suicide attempts in our community? Our youth is suffering. It is suffering. So I'm a data person. The first thing I did is I went online. I wanted to know what the data said. So I went to the CDC's website. And according to the CDC, during 2020, the proportion of mental health-related emergency department visits among adolescents aged 12 to 17 years increased 31% from that during 2019. In May 2020, during the COVID-19 pandemic, emergency department visits for suspected suicide attempts began to increase among adolescents, especially girls. During February 21st through March 20th, 2021, suicide attempt visits were 50.6% higher in girls and 3.7% among boys. Children have a 99.997% chance of surviving COVID. There is no reason for this. In our society, we weigh risk versus benefit. And what we're doing here is insanity. And unfortunately, our school board is stuck between the state and all their guidelines and them dangling their money above their head and us parents and what we want for our kids. And we're the ones who have to put them together again at the end of the day. We're the ones who have to help them through this. And you know what? I'm a homeschool mom, and I'm telling you this. If they're stuck and they have to follow what the state's saying and you don't like it and your children are suffering, it's time for us as parents to step up and say enough. And I will be available after this. If anyone has any questions, I would love to answer questions and give you any kind of information you need to start your homeschooling journey, because the only thing our state is going to listen to is when we pull our children out of this system and say enough. And I am not against all of you. I'm not. But it's time to put the kids first. They're the ones who are suffering the most.
All, I want to thank you for your hard work and dedication to our teachers, students, and families. This has been a challenging time, and there's so many opinions, frustrations, and emotions over what this last school year was like and what the future school year will hold. I know many of the decisions you have to make are out of your hands. While this may be the case, we do have a lot of power to locally decide what is best for our children, families, and staff. It can be scary to stand up to the powers that be in this time of uncertainty. I feel it is time to stand, and that we can do that collectively, despite our differences. I believe there are solutions out there that can meet all needs. Secondly, I want to state that I have 20 years of experience working with kids. If anyone has observed a small child pre-K through 3rd or even 4th grade wearing masks for an extended period of time, it is easy to see how unsanitary it is. Kids tend to be kind of gross, especially the little ones, sneezing, picking their nose, chewing on their hair, biting their nails, etc. Add a mask to that equation, things get exponentially gross. And those are just the kids who have those habits. Most kids fiddle with their mask, touching it frequently to adjust it or take it up and down. Even adults do this. The longer a child or anyone wears a mask, the more that piece of cloth becomes contaminated. Adding further concern, this piece of cloth slipped directly over their nose and mouth, the gateway to germs and illness. I think many well-intentioned people have tried to slap an unfit solution to the problem of COVID spread. It comes from a place of concern and care, but in practicality, it doesn't work, especially with our littles. Furthermore, conscious discipline, the behavioral model our school district uses, relies heavily on emotional facial cues. Another vital component of conscious discipline is breathing. The importance of breathing to calm oneself or prepare oneself for learning is foundational. We start the day with breathing exercises, emphasizing how important it is to have proper oxygen flow to our brains, to optimize learning, and to regulate our emotions. I am surprised covering our breathing passageways can even be used in conjunction with conscious discipline. Many kids have trauma from their homes and things that trigger them throughout the day. Breathing and facial cues help these children and adults work together to regulate emotions. This cannot be done with our faces covered. My son is kindergarten age, and I do not want him in an environment that is going to stunt his social growth. I believe we are dangerously stunting our children's emotional and relational growth detrimentally. Is COVID a serious disease that we need to consider? Certainly, but not at the cost of our children. I taught private reading groups this last year. One child had an at-risk family member that would come to visit her occasionally. Before this family would come to visit, the student would mask and distance for a few weeks while attending my group to help cut down on the possibility of getting COVID. This seemed like a very reasonable solution. Can we provide students and families who are concerned with COVID the option of masking and distancing while not forcing it on the whole group? Solutions like this need to be brought to the table and seriously considered. One size does not fit all. Anyone in education knows and understands this. Forcing a whole group of kids to mask is not equitable. Some kids can handle it, other kids cannot.
I just have a couple bullet points. This is a way bigger issue than masks. Obviously, it's political now, and that's why we're all pissed off. Kids aren't the problem. They're not the super spreaders that we're led to believe. Masks are not healthy, and you guys need to continue to push for the local control of the policy.
My name is Brady Sage. I'm a substitute for the last person called up. I'm a substitute in Baker, the Grande, and Grande School Districts. I have personal relationships with hundreds of kids in our region. In the last week, I have been a substitute teacher in the summer school program, and masks have not been required. And today, I noticed one of my bright, going into 2nd grade students had a little dimple on her face that last year I would never have noticed, and it was kind of like a moving moment for me to realize that this is something that we need to stand up against and make our voices heard. And I understand, as repeated already, that school boards and administration are in a tough position. But I don't see a lot of those leaders standing up and taking a position to advocate for the people who very vocally expressed what they want from our leaders. And it's my understanding that a lot of these guidelines, mandates, and recommendations are pushed upon us by people that we didn't vote into those positions of power. And we're just trying to do our best to provide for our families and keep our children happy, healthy, and educated. And so, I felt really compelled to come up here and express my position. The past year, which has been mentioned, kids don't properly use masks. Like, there can't be any science to defend a child by, they get there at 7:30, by 9 o'clock, their mask is soaked. I've handed out hundreds of reusable masks to replace the kids' masks that have been already tainted by their hour or so into the school day. Reusable blue masks that say on the box that they don't actually protect against COVID-19. So, are we following the science, or are we following unelected bureaucratic leaders who have a political agenda?
Hey, I'm Jason Kerr. I am a chiropractor in Grand, Oregon. I was born at Grand Round Hospital. I went to Central Elementary. I went to LeGrand Middle School. I graduated from LeGrand High School. I have 4 children going through this school. One of them just graduated. I have another one that's a senior, and I have 2 that are sophomores. My boys, they don't sit still very well in the first place. My boys are wrestlers, and trying to restrain them is not something that works at all. They were having a hard time with the masks last year, and we decided to pull them out of school. And we aren't putting them back into a system where masks are being used. So I wanted to talk a little bit about the mask and give you just a little bit of information. I've given it many a time, but it doesn't seem to be well received. The CDC did a study in May of 2020 where they reviewed evidence from 14 randomized controlled trials. Those are the gold standard in science. And at the end of that study, they stated that masks did not support a substantial effect on transmission of laboratory-confirmed influenza. That's what they had to use when they started deciding on masks. Now, a little bit later on, the latest study that actually came out was a Danish study. The Danish study came out in the Annals of Internal Medicine in November of 2020 with over 6,000 Danish participants. The difference between the masked versus the unmasked contact with SARS-CoV-2 was not statistically significant. The science is not settled. The science is divided at best. And we're going to use our children as pawns for some science that's not settled. You guys swore an oath to that Constitution. In that Constitution, we talk about liberty. I believe that's included in there. And liberty is the quality or state of being free, the power to do as one pleases, freedom from physical restraint, freedom from arbitrary or despotic control. I would have to say that this is a freedom that our kids need to have. This is a freedom that they've earned. This is our society, and the science is two-sided. You know, we also said up here earlier, and we pledged an oath to the flag, and one nation under God. And my family follows God, and we will continue to follow God. And as of right now, we're going to take our children out of the system and put them in a place where we can continue to follow those values of the Constitution, and God is our leader. Thank you.